Anorexia nervosa. What is it? Anorexia nervosa, better known as anorexia, is an eating disorder that features extreme weight loss. Those with anorexia nervosa suffer from a very low body weight. This disorder can be life-threatening depending on how severe the case is. History. Anorexia nervosa was rare before the second half of the 20th century, but it has been around since the early 12th century. Symptoms. There are many signs and symptoms of this eating disorder. Restrictive eating or dieting far beyond the norm, rapidly losing weight, being significantly underweight, obsession with calories and food. A major sign is ritualistic eating patterns. This would be cutting food into tiny pieces, eating alone, or hiding food. Symptoms continued. A very common symptom that women with this disorder have is loss of menstruation for long periods of time, also known as amenorrhea. Sometimes there is loss or thinning of hair. Isolation is very common, avoiding family, friends, etc. Often the individual is experiencing depression as well. And sometimes they will wear bigger clothes to hide their small figures so people don't notice. Then they want to avoid their families so their families don't notice as well. Who does anorexia nervosa affect? It is difficult for experts to name a definitive number of people that have anorexia, but it is estimated that 1% of female adolescents have anorexia nervosa. Most patients with this disorder are girls and young women between the ages of 15 and 30, but anorexia can affect any gender or age. And there's a woman with a pretty severe case. You can see all of her bones. She's pretty hollowed out. Treatment. If the patient is in a life-threatening situation, their doctor may send them to a hospital emergency room to seek immediate attention. A patient would be sent to the emergency room if they were experiencing symptoms such as heart rhythm disturbance, dehydration, electrolyte imbalances, or psychiatric emergencies. That's kind of how they see themselves, even when they're very skinny. They think they're fat. They're almost never satisfied. They measure themselves a lot. They weigh themselves a lot. Treatment continued. If the patient's life is not in immediate danger, their healthcare provider may suggest frequent monitoring of vital signs, hydration, and other physical conditions. Therapy may also be suggested. The therapy may be individual or family-based. There is no medication that will directly treat anorexia nervosa, but medication may be used to treat other medical health problems such as depression that affect anorexia. Causes. Anorexia usually becomes apparent at the age of 17. Most of the time, it starts when an individual attempts to diet, but it turns into something much more when they begin to cut out important nutrients from their diet. Patients usually become so obsessed with losing weight that it's all that they can think about. Psychological causes. Although many eating disorders are started by obsession with food and weight, they are often turned into something more. A patient may use their eating disorder to feel as if they are in control to make up for some other stress that they feel they have no control over. Anorexia may also be caused by low self-esteem or a feeling of inadequacy. Social causes. Anorexia nervosa can develop due to bullying, overweight, or a difficulty in expressing emotions or family problems. Patients may also feel the pressure put on them by society to be thin or fit, thus causing them to diet an unhealthy amount. Mortality and recovery. For those with no treatment, the mortality rate is 20%. The mortality rate of anorexia nervosa is the highest of any other psychological disorder. When patients seek treatment, the mortality rate falls to 2 or 3%. Controversies. There are controversies surrounding the correlation between the influence of social media and anorexia nervosa. There are trends such as Thinspiration, Promia, and Pro-Ana. Thinspiration is basically, there are just sites encouraging users to lose weight. They mainly use unhealthy patterns to lose this weight. And then Promia is pro-bulimia, and Pro-Ana is pro-anorexia. And these are websites where an individual can go and view pictures of someone else with anorexia and get advice on how to maintain an eating disorder that maybe someone else on this website is maintaining, and they're giving advice how to. A lot of people say, you know, like, don't stop starving yourself until you are happy on these sites. I don't know. It's very messed up. Quick facts. To the Bone is a very good movie about anorexia nervosa on Netflix. I've watched this. I liked it. Lady Gaga has struggled with anorexia nervosa for many years. It started when she was 15. She now has a Born This Way foundation that helps people who are also struggling. Demi Lovato struggled with bulimia and anorexia for years before seeking help and is still in recovery. She's now an official spokeswoman for young people with eating disorders. And that's it. These are all of my sources. I have 8 of them. Okay. Thanks.